pregnancies with this, just by this ovarian drilling. It's a wonderful, method. It's such a simple procedure and it's giving us very good results. Earlier we used to just do a diagnostic laparoscopy. Nowadays we going for this drilling and it's giving wonderful results.
And then one article I was saying clomiphene plus dexamethasone prescribing combined. What?
If there's any adrenal part of androgen secretion, that will suppress those androgens and adrenal formation of androgens.
That's why
because 50% is by combined androgens in the peripheries, 50% by ovaries and the adrenal, and 50% is from peripheral conversion. So just to prevent that part, especially in obese patients actually. Also we give estrogens in the second half of these kind of patients because they are in a hypoestrogenic state. If we give anti-estrogen, actually clomiphene is an anti-estrogen. So sometimes we prescribe even estrogens in the second half of the cycle, just after the ovulation induction drugs are over. So a lot of things are coming up. This includes the whole of endocrinology in fact.
Basically in 1935 when it was still Leventhal, the first reported that throughout the world that common for all hormones, whole endocrinology, particularly sex hormone related, all are combined in single syndrome,
yes.
still Leventhal syndrome. So it is such a common and complex biochemistry of this that every patient, that's why treatment, as rightly said, is usually individualized. Otherwise individualization is the number one treatment step. Number two, whether it is pregnancy wanting or not wanting.
Another thing about adolescent girls, we can have some awareness programs that just by reducing 5 to 10% of the weight, we can ameliorate most of the symptoms and signs. So I think something. See, if there is a pregnancy, that what we have seen is at least 2 to 3 years there is amelioration of symptoms. First of all, she is breastfeeding that part of the time of 1.5 to 2 years. But after that also she will not need any medications or she will not be symptomatic for another 2 to 3 years. Because there's total suppression for 9 months. So what we do, actually in the practice what we do when this kind of girls come to us, we give them 3 to 6 months of oral contraceptive pills, low dose pills. What that causes is to totally cut off the hypothalamic pituitary ovarian axis. And we don't cause monthly development of follicles. What happens by monthly development of follicles, they get arrested in any part of that maturation. So that is thecal luteinization, this thickness of the stroma, that itself will cause increased androgen production, and it will cause an androgenic milieu in the ovary. So we want to suppress that. That is suppressed by oral contraceptive pills in the OPD when this adolescent or young married women come to us. So pregnancy itself does that. So once it is suppressed, and when you stop that, the ovulation starts again, rebound phenomenon, and that continues for at least 2 to 3 years. But then again, when the women come to us with irregular cycles, it's very easy to treat at that time. But when they want pills, contraception at the same time.
How much PCOS are going in endometrial carcinoma? Endometrial carcinoma and PCOS relation. Women in literacy.
Less than 40 years, it is less, 10 to 20%. But if it is not corrected, so we say in PCOS cases when we cannot allow them to go from amenorrhea for 2 to 3 months every cycle, we have to give them a withdrawal bleeding every month. Give them for first 7 days of the month, make it a routine. Suppose they don't want pregnancy, they are contraindicated for oral contraceptive pills, at least a withdrawal bleeding every month is a must. So that we don't have adenomatous hyperplasia which can lead. In just cystic glandular hyperplasia is 0.4 to 5%. But in the adenomatous hyperplasia, that's why endometrial curettage after age of 40 is very essential for these patients. It is quite high, 20 to 30% if it is adenomatous hyperplasia. So we have to follow these patients, actually follow them in so many aspects, so many angles you have to follow them up.
What is the rate of ectopic pregnancy in case of drilling?
Pardon?
Ectopic pregnancy in the case of drilling?
There is no study as such of ectopic pregnancy. There is no relation between ectopic pregnancy and drilling. Endometriosis you may say for pelvic inflammatory disease, but for drilling, why does it come to your mind?
It is a clomiphene induced multiple pregnancy.
Multiple pregnancy. He is saying ectopic pregnancy. If I have heard you right.